Now we're going to look at the social explanation of schizophrenia, social causation slash social, the environmental breeder idea. Sorry, and I spelled environmental wrong. Should have an N in there. The environmental breeder hypothesis. So remember, this suggests that those from lower classes are more at risk of developing schizophrenia. Again, lower classes should really be in inverted commas here. Lower social classes, these include socioeconomic status, so poorer people, those of ethnic minorities, second generation immigrants. Oh, wrong there. Second generation immigrants, people who live in big cities versus those that live in the country. Remember, first generation immigrants, by the way, don't suffer this more because we believe they have some sort of hardiness about them. They are the ones who've travelled to get to the country that they're in. They strive, they have some sort of personality thing that protects them from schizophrenia. But all these other groups are at greater risk of developing schizophrenia. This is believed to be because it leads to greater stress. Remember, stress of poverty, whether it's not being able to get adequate housing, not being able to buy the things that you want, working long hours and still not feeling like you're getting anywhere, or ethnic minorities being in the minority itself, having that pressure to be that is being different from everyone else, possible examples of racism, things like that. This stress triggers the disorder of schizophrenia. This ties in, remember, to that stress diathesis model, which is obviously that diagram where I've got a graph and it's got like the curved line running through the middle. I'll find a picture of one and show you it later on, but you know what it looks like. So this ties into the stress diathesis model. So families of low social class or low background, those with ethnic minorities, etc., are more likely to develop schizophrenia. We've got various studies to support this. We've got the likes of Dowrand, which showed that the incidence of schizophrenia in lower classes is significantly greater than in higher classes. We've got other ones that are on your kind of sheet that I gave you. Velling, which is a Dutch study. The high rates of psychotic illness found among Afro-Caribbean and other black immigrant groups in the UK and abroad is higher than white people. If you look at the workbook that I gave you on this, or look at the PowerPoint slides which are on Moodle, you will see that there is actually a massive influence of this sort of thing. You will see all of these studies that show that not only do black people get schizophrenia more, their chance of schizophrenia increases the more white people who live around them. The smaller a minority you are, the greater the result. There's a study by obviously Pedersen and Mortensen, which looks at the big city idea. People who live in larger cities are more likely to develop schizophrenia, and your risk increases the longer you live there. But we can evaluate all of these things as well. Remember, this is just a correlation. Yeah, it's not a causal link. So there are other interpretations of this. One possible factor being that lower class families are exposed to more risk factors. So it might not be the stress, it might be more risk factors like illness. Remember, sometimes having the flu when women are pregnant can be a trigger of schizophrenia. And there's more ill people and more kind of dirt, grime, things like that in a city. Evidence of levels of schizophrenia in immigrant groups might be because, again, they are in the lower class usually. Whereas if they were in their own country, they may not be. There's problems with, remember, this. It might be a factor of social drift. So it might not be that living in the city causes schizophrenia, but having schizophrenia causes you to move to a city. Remember, housing is cheaper in the city. There's more medical care. Ironically, you are kind of less socially connected. All of these things that schizophrenic people may have that will draw them to a city. So it's not necessarily one way or the other. Obviously, it ignores the other explanations, like the biological or genetic one. But again, stress diathesis brings these two things together, and is a brilliant way to kind of bridge the gap between them in an essay. There should be something else I'm thinking. Oh yeah, the other thing that could possibly influence the results are the fact that it's biased, possibly. So perhaps black people or second generation immigrants or the poor are more likely to be diagnosed with schizophrenia. It's not that they actually get schizophrenia more, it's just that doctors are going to feel more comfortable or more confident diagnosing them with schizophrenia, or in reverse, richer people are less likely to be diagnosed with schizophrenia because the doctors don't feel confident in doing that. So we can question whether it's actually a real thing, this, or whether there's extraneous variables that affect the results. So after these two explanations, we need to start looking at the treatment. Oh, sorry, we can also have comparisons between them. Again, the comparisons between the biological explanation and the social explanation should be fairly obvious. There they all are on screen, but we're pretty much talking about whether they actually, how they explain things differently. So the biological model explains it one way, whereas the social model explains it another. Another strength, by the way, of the biological explanation of schizophrenia, which I can't remember if I said, is the fact that drugs actually work. Wait, I did definitely say that. I've just remembered, so we can move on. It's fine. We'll come back to study methods in the next video when we do we'll do it now. So on the screen now are 3 different methods of studying schizophrenia. And remember, you need to know 2 of them. Twin studies and adoption studies will be the preferable ones. So again, we compare MZ twins to DZ twins in schizophrenia. In twin studies. This is running on the assumption that the MZ twins share all of their genetics and all of their environment, whereas DZ twins only share their environment. Their genetics are different from each other. So if the concordance, if the similarity on diagnosis of schizophrenia is higher in MZ twins, then we can say it's genetic, whereas if it's the same MZ twins and DZ twins, we will put it down to environment. Obviously, we'll use Gottman and Shields as our example here. Remember, the strengths of twin studies are they pull apart nature and nurture, but weaknesses are things like we assume that MZ and DZ twins have similar environments to each other, and they are kind of comparable, but MZ twins are more likely to be treated similarly than DZ twins because they look the same, and whereas DZ twins could be very visibly different, especially if one's male and one is female. Adoption studies, again, remember, work by comparing the biological parent, the biological mother, to the adopted mother to see if one of those has schizophrenia, and then seeing what's the chances of the child themselves developing schizophrenia. If their biological mother has schizophrenia and they develop it, whereas their adopted mother doesn't, we would say that that is a biological factor. Whereas if their adopted mother has schizophrenia and the adopted child develops it, we would say it's probably due to the environment. And again, we can look at this in all the different combinations of whichever parent has schizophrenia, and we compare that to the base rates for other people. Generally, remember, again, it's got the same strength, and we can look at nature and nurture. The big weakness being we assume again that the environments are different, when really you are more likely to be adopted by someone that has a similar background to you. So their environments might be more similar than we anticipated. So now I'm going to do drug therapy for schizophrenia. This hasn't came up exactly on the exam yet, so what we've got to look at is this very general blurb about drugs. So I'm going to include this and look at my own kind of slides on drugs as well to fill this in a bit. So the drugs work in a very simplistic way. We know that schizophrenia, or we think in this particular theory, that schizophrenia is caused by having high levels of dopamine or being extra sensitive to dopamine or something like that. So the biological treatment is to do something that lowers that reactivity. I closed the wrong thing there. It lowers that reactivity in some way, shape, or form. So it works really. The drugs for for schizophrenia, work by blocking the receptors. So if we block the receptors, that means that signals cannot get through anymore. All that excessive dopamine just does nothing because we've blocked the receptor, in particular that D2 receptor. Remember, there's 2 types of drugs: typical antipsychotics, Antipsychotic being any drug that treats schizophrenia and alters kind of brain chemistry, which is what a psychoactive drug is. They were first invented in the 1950s, whereas atypical antipsychotics were invented in the 1990s. Big differences between them is kind of some of the side effects, how they work. So phenothiazine is a typical, clozapine is an atypical, and they both work by blocking those receptors. But the atypical ones are more precise in the receptors that they block. So we can talk a bit more about that kind of in the exam and things. Remember, typical antipsychotics mainly cure just the positive symptoms, where atypical ones might cure the positive and the negative. The big question is, why don't they treat the negative? So even the atypical ones treat the positive much better. If schizophrenia was truly just caused by high levels of dopamine or being receptive to dopamine, having too many receptors or whatever, then we should expect them to treat all of the symptoms easily. But it's not necessarily true. That's not the way it works. Again, we're going to look at the uniform recap. This is general evaluation of drugs. We don't have one specifically about schizophrenia yet, so I'm going to add a couple more on the next slide to show you a couple. These are the ones that are available on your study summary sheet. So Kane is a famous one. Kane gave patients flufenazine, and we can see how they basically recovered. They recovered from the schizophrenia. Hoggerty is another one. Hoggerty found that there was a lower relapse rate when you were on medication than when you weren't on medication. Therefore, the medication is an effective, useful treatment for schizophrenia. There they are again, if you want to pause this to look at them, but they're on the sheet you've already got. We can talk about counter-arguments, or indeed we can talk about other explanations. So another treatment, remember, is the social aspect or the token economies. We'll talk more about that in the next slide, and it's a matter of just expanding on that in your exam answer. When it comes to drugs, we can go to town when we talk about validity and usefulness. So remember, drugs don't actually treat or cure the problem, yet they just mask the symptoms. We give you medication which stops your symptoms, but it doesn't cure the underlying cause. When you come off medication, your symptoms come back. Which means you might also, second point, become reliant on this medication. Remember, it's not just dopamine that's involved though. If it was dopamine, that was all, this effect would be instantaneous. You would get better as soon as you took the pills. But that's not the way it works. Strength though, drugs help you function usefully in society. A strength that these have included, which is bizarre, is basically it's not as bad as ECT. It's not as bad as electrocuting you. You could also say the same for lobotomy. It's not as bad as giving you a lobotomy. So again, usefulness and validity though, you might become reliant. It's depowering, that you have no control or influence in this. It's just due to the doctor giving you medication. The big one, remember, is the idea of cause and effect. So we're assuming that you have schizophrenia because of the dopamine, when really it might just be an effect. And I've realised that's a strength, that's a big weakness of the biological explanation, not the biological treatment. Apologies. Some people have suggested that these medications are what we call a chemical cosh. Yeah, we give you the medication and it makes you easier to manage. So social control type things. The side effects are especially debilitating. Side effects are a massive problem with any drug treatment. Remember, one of the big problems or side effects with schizophrenic drugs is the process of tardive dyskinesia, that constant movement of the mouth. And in 75% of cases, this is unreversible. That was Hill 1986 there. We could also see what could happen with the other side effects. You might have sleepiness or drowsiness. You will be confused. You might have low blood pressure and sexual problems. Men can't get erections because of this. You might gain weight and lose your appetite. So there are lots of side effects, and we can evaluate that on ethical issues. And I'm sorry I went through this quickly, but my video is about to run out in about 10 seconds, so I'm trying to get through it. Right, we'll look at the next explanation and the next treatment in the next video.